Hey, how you guys doing? This is Tyree from Players Health. Just wanted to give you guys a quick demo as a coach to go in and get set up. Here at Players Health, we really want to make sure that all of our coaches get in the system and are able to hop in and be able to manage all their athletes really effectively. So, of course, you can log in with your Sport Engine ID, and then that's going to automatically log you in. Of course, I already have all of my information kind of plugged in, and I'm going to start off as a coach. One thing you're going to see when you first pop in as a coach is you're going to see a dashboard that looks like this. It's going to have 0 across the board because we haven't documented an injury yet. But we really want to make sure that everyone gets in, creates their profile, get their athletes, get access to their athletes so they can see all this information. But this is the first thing that you're going to see. You're going to see no data here. You're going to be able to pop in and see your teams. So there's a couple ways for you to go and manage teams. You'll always be able to search in this search box right here where it says team athletes. Let me just type my name. I can pop in. I can see my athlete, right? But I can also go in and look at my participation. And when I look at my participation, I see all of my athletes here as well, and I can view this. I can also populate, and I can be a part of more than one team. So, of course, you all may or may not be coaching maybe one or maybe two teams, but if you have access to this, you'll all automatically see the teams that you were invited to, and you'll be able to see those teams that you're associated with. Now, once you start documenting injuries, you're going to start seeing a dashboard that populates like this. You're going to see all of your return to plays. And the idea is that if we have any possible head injuries or concussions that we document, we want to make sure that we have proper medical clearance before we can return them back to play. So if I look at this athlete, this test athlete that I have, this green little smoke here shows all of our athletes that have been returned back to play. So this is proper medical clearance. I can look at athlete test 1, that the parent was that the compliance form or the clearance form for the doctor for this head injury was uploaded and that they were allowed to return back to play. This athlete is returned back. So we did really good at making sure that this athlete was properly returned back. We always have to make sure that we have proper medical clearance and proper guardian clearance for the return back to play. It's either going to be one or the other, but we definitely always have to make sure that we have proper medical clearance. It's going to have the date of who documented and who uploaded it. So this is an easy way for you to track this. But if you keep scrolling down, of course, you'll see the top 5 injuries or the injuries as you come through the month. You're going to see all of your age demographics. You're going to see gendered incidents. So I can look at all of my female athletes and see all of the injuries that we've documented. This makes it really easy for me to go in here and track this. You're going to always see the top 5 locations of where injuries happen. They happen on the football field, gymnasium, baseball field. You'll always be able to track that information. And then, of course, you're going to see the top 5 locations of where these injuries happen in terms of the body part. A lot of head injuries we have. I see knee injuries, but maybe I want to go in and look at all of my knee injury athletes. I can see that. I want to see all of my head injury athletes. The system is going to show me all those athletes. So it just makes it really easy for us to go in here and manage this as a coach. So when it comes to managing participation in Players Health, we've made this really easy as a coach. Once an injury is documented, so Alex Brown has an injury, the mom dropped Alex off to practice, and they are cleared, but we still need to have them upload the medical clearance for this head injury. This is the first thing that you're going to see as a coach. This basically lets you know as a coach that this kid should not be playing. An injury report is active in their system, and that right now they are the status is no physical activity. So they can't do anything. The system is going to let you know as a coach to make sure that they're not playing until they're updated. Of course, our system is going to let you know that we're not a healthcare provider. Players Health is just a platform that allows you to communicate all this information with the people that care the most, the medical professionals and the parents. So I can do this and say we want to trigger a return to play. As a coach, we can't return an athlete back to play. It's not a good idea for us to do that anyway. We're not doctors. So we want to make sure that the medical clearance is uploaded. Now, you can upload a medical clearance if it came from the parent, but the parent still is going to have to sign off on it. So there's no way for a parent to not sign off on a head injury that's documented in the system. So I can go in here and I'm going to still populate my head injury. I can upload that. We can take a picture of it, everything that you need to, but as a coach, I still can't return the athlete back. I automatically can't do that. It's just gonna let me know that I can't, and that the parent is gonna have to go in and do that. So all of this just makes it really easy for me to manage this. And then when it comes to an athlete's profile, so say I've never clicked on this athlete before, the system is going to automatically let me know that this athlete has a pre-existing medical condition, and that maybe there's an emergency and we had to call the ambulance, but the parent is not there and we need to have access to the kid's record. The system pops up and lets us know. I see the parent's information here. I can make calls directly through our app. As you guys all know, we have an iOS and Android app that you can download, and you can do everything that I'm showing you here from your phone. And then I see that Alex has asthma, but that may or may not be privy to the situation at the time. And I also see any previous injuries that they've had. Now, of course, this allows me to be able to communicate and understand all of this as a coach so that we're not out of the loop when it comes to their injuries. And then when it comes to documenting an injury, we made it really simple for a coach to do that. I'm going to walk you through that and just try to make sure that we are fully understanding that we're not diagnosing any injuries. All we're doing is documenting an incident. So this incident happened on this time, on this day, at this time. Right now, it's about 3:47 my time. It was a practice. We were playing for the P8 soccer team, and we were at, you could type in any place. So I'm from Chicago, so we were playing at Soldier Field. Go Bears. And I can go in here and I can see that we're at Soldier Field. This was a football field and we were playing on grass. And then I don't have to put in the equipment, but all of it's there. All of the manufacturers there. It's up to you whether you want to document that. You really don't have to. But say it is a head injury, the system is going to let you know. We have to remove this athlete from play immediately. And then this will allow us to be able to go ahead and get the medical clearance and trigger the concussion return to play protocol that's automated in the system. So automatically we say, yes, we remove the athlete from play. We follow the rules. Was the athlete in pain? On a scale of 1 to 10, 1 being not a lot of pain, 10 being a lot, we're just going to say maybe 7. How did the injury happen? Did they have direct contact with another athlete? Was it direct contact with the playing surface? We're just going to say they ran into another athlete. That happens a lot with these athletes. So we're just going to say ran into another athlete. Makes it really easy. Was there any swelling, bleeding? Was there any broken bones, fractures, anything? These are normal questions that we should all be asking. And we just say it was some swelling, and then we could upload pictures, videos. Say a picture of a helmet that was cracked or something that you need to know. This could help the doctor when the parent takes them to see their doctor. No physical activity, of course. And then maybe we gave the athlete some ice as the onset. We'll say some ice, bag of ice. So you can go and document that, save it, and then I can update. Once I update, now everyone is notified. I see exactly that we're at Soldier Field. We documented all this information. And once again, and in terms of return to play, you always need that medical clearance for a head injury. So all of that allows us to be really clear and understanding exactly what goes on when it comes to communicating. Now, you do have messaging capabilities with Players Health. We've thought of everything. So you can go in and say, practice is at 1 p.m. or 1 p.m. today. You can easily send this to all the parents if you want to. You can send it to an individual parent if you want. Just type in their name or type in their email. Or you can send it to all your guardians. So you just say, I'm going to send this practice to all of my guardians. I'm just going to say this is a test message. And that is going to go to all my parents. So we just made it really easy for you to go and do that. This is going to send everyone an email. It's going to say, are you sure you want to do that? Yes. And all of those parents were notified. So as soon, and I'm going to show you what the emails look like so that you can get a good feel of how much information we're equipping the parents with when they're notified. But once the parent, so this is what I sent them. I sent the test message. This came directly from you. It looks just like it came from an email. But if an injury report is documented, we have just shown all of this. So the logo of your organization is going to be here. Left, head, no physical activity, any suggested care. There's all these things you can now add to the system that lets the athlete know that we need a medical professional to view this athlete before you can return their athlete back to play. All of this lets the parents know their role in this, so it's really important that we document. Now, a lot of coaches always ask me, when should I document? Should I be doing this right on the field, right at the game? The likelihood that you're going to be doing that is low. But our rule of thumb is that you should never let an athlete leave your site before you've documented that injury. So right after the game, right after the practice, stop, ask those questions, get the information, communicate it to the parent before that athlete leaves and goes with their parent or goes home. That is the rule of thumb. Never let an athlete leave your site after an injury before you've documented it. And you can do everything from your phone. As I said before, we have an iOS and Android application you can download. Everything that I just showed you here, you can do from your phone. Here it is again, Tyree Burks from Players Health, just giving you guys a coach's overview of how you view all of your information as a coach. Always, if you have any questions, if you guys are wondering what we do next and things like that, or you're having some issues logging in, contact us at support@playershealth.com or give us a shout. Our phone number is on our website at 872-202-6258. Looking forward to chatting with you. Talk to you soon. Bye-bye.